What if I told you that veteran suicide rates are 1.5 times regular suicide rates in the country? Why are they so high? And in the increased focus on mental health throughout America, why are veterans so often forgotten? Is there a difference in the challenges that they face? And what are those challenges and how can the community help? That's the mission of America's Warrior Partnership. We're joined today by Darrell Owens, a veteran himself and Director of Government Relations at AWP, to answer those questions and so much more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. Mental health has been in the limelight in our society for quite some time. Conversations, even on our show, about how we help young men and women who are struggling with mental health issues, who are facing the idea of suicide, and how the community can come alongside them. But studies have shown that suicide among veterans in this country are at least 1.5 times greater than that of the general populace. So why is that? What challenges do our men and women in uniform and our veterans face? And what can we as a community do to come alongside those who have sacrificed so much for our safety? We're joined tonight by Darrell Owens. He's Director of Government Relations at America's Warrior Partnership, a veteran himself. Darrell, welcome to Face the Issues.
Hey, Sam, thank you very much for having me. Big fan of the show, and I appreciate you having me on.
Well, I appreciate you saying that. We didn't pay Darrell to say that, but I appreciate those kind words, Darrell. Hey, welcome. And before we even get started, thank you for your service. You're in the Army Reserves.
Thank you, sir.
And we deeply appreciate your service to our country.
Sam, I got to tell you, it's been an honor to serve my nation. I love it every day. And I'm really glad you had me on to talk about these issues. I don't think there is probably a more pressing issue right now facing veterans than veteran suicide.
Well, let's get to it. Let's start with a statistic. I mean, the statistic that's out there is 22 veterans a day commit suicide. You see all these organizations called like 22 a day or 22 this or 22 that. That's kind of the talking point, the narrative that has been built around veterans and suicide. Some have argued that it's a lower number, that's 16 or 17. Your organization has dug into this. You guys have argued that it is a higher number when you look at the statistics. Regardless, it is significantly higher than numbers for other demographics in our society. Let's start with the number. Your organization has said it's significantly higher than 22 a day. Walk us through how you got to that number and why you see that in the statistics.
Thank you, Sam. For the past 15 years, the VA suicide rate has gone up dramatically. And every year, the VA releases their annual suicide study, where they look at all the data. They get the data amalgamated by the CDC. It comes from the states. It's all anonymous data that comes in. And then they put it through their own metrics and their own formulas at the VA, and they come up with this magic number. We haven't been able to get the full methodology on how they get that. So despite working with Congress on this, the VA still refuses to fully just explain what their methodology is for this. So to look at the problem, to figure out just the extent of what the issue is, America's Warrior Partnership started what's called Operation Deep Dive. And it's a suicide study. It started at the University of Alabama. We partnered with them to help get the data and store it there. Now it's at Duke University. Their School of Institutes, their Institute of Medicine there has taken it over and taken the ball and run with it. But the bottom line is it's really simple. We went to the states and said, hey states, give us everybody who's died that year. So 2017, we started collecting data from a bunch of states, everyone who died. We get the full list, Social Security numbers, date of births, all that stuff. And then we go to the Department of Defense and we say, hey, DOD, can you give us their service records? Here's all the info. And so DOD would come back and say, hey, here's who served, here's who didn't. And so we had their full service record. Then we go to CDC, we put together a methodology with them on defining suicide, et cetera. And we have a very simple way of looking at it. We can go back and point to every single suicide in those years from those states. Right now, we're up to 8 states. We're growing rapidly up to 12 this year. And I think we're going to have 8 more coming on next year, hopefully. And so we have the actual hard data to look at it. And the numbers are staggering. The VA is missing a lot right now in their numbers. And I can explain more on that if you'll allow me.
Yeah, I mean, absolutely. And Darrell, we'll get to that. Before we do that, I want to ask you this. The American Psychological Association has said that suicide rates among veterans are at least 1.5 times that the rate among everyday Americans. Some have said it is potentially twice as high. Listen, I mean, I think not just for veterans, for anybody, we would say one is too many, right? I mean, the goal of any of these organizations is to help stop suicide. But why is it so much higher among veterans?
So there's a lot more stressors on veterans. There's a lot more prior traumatic experience. I mean, we've been at war for 20 years now. So a lot of the folks who are coming back, who've been multiple deployments, are coming back and they've seen a lot of things. They've gone through very traumatic events, and they come home and to be frank with you, the transition back home hasn't been easy for a lot of these veterans. And so when the VA is turning their back on them, and you break that trust with the VA, and some of these veterans feel hopeless, their only way out at that point, as they see it, is to take their own life, and that's unfortunate. We can prevent that. These are all preventable deaths. And one death is far too many. We completely agree. The whole point of Operation Deep Dive was that we can look into the data and start targeting these individuals, start trying to find them before they get to that point of hopelessness, and be able to identify them, bring them back into the fold, bring in the resources they need to help get better. And we have the data to do that. We're working with the VA right now. The VA is not sure the data, but we're working to try to identify those individuals. And instead of being reactive to have them come to us, let's go out and find them. It's a very simple premise.
Yeah, absolutely. And I'm going to ask you a little bit more about that here in a moment. But one of the things you said, Darrell, was this trauma that veterans will face in war and the challenges of adjusting to life back home, whether that's civilian life if they leave the service, or even for you as a reservist, for people in the National Guard, they go and they come back to a civilian job. I mean, let's start with this. Experts have always said that what leads to increased suicide rates are if there's mental issues, there's mental illness. If that leads to addiction, your chance of suicide goes higher. Of course, among veterans, one of the leading situations that we look at is PTSD, post-traumatic stress disorder. What is it like to have PTSD for a veteran? Where does it come from? Just walk us through that challenge a little bit for those of us who've never served, who've never put on a uniform. What is it that they see and how does it impact them? What is it like for somebody who has PTSD?
Well, first, let me start off by saying that there's a lot of veterans out there. Every veteran experience is completely different. That's why you can't put veterans out there broadly, because every veteran has a different story and a story to tell and had a different experience. But, and I want to point this out very, very clearly, not every veteran has a problem. Mm-hmm. The vast majority of veterans are doing great. They're succeeding. They're crushing life right now. They've got great families, great jobs. They're in their communities, giving back. But there's a narrative out there that every veteran is somehow broken or has PTSD or is struggling in some capacity, and that's not true. The vast majority, well over 90%, we do an annual survey every year of veterans, and the vast majority are doing great. It's a small percentage who are struggling with that, and those where our resources really need to be. But you're coming back, you've got the big signature wounds of this war in both Iraq and Afghanistan were IEDs. And IEDs, when they go off, have TBIs, and you don't know when they're coming, so it's not like you're in a no-kidding firefight. These are hidden bombs that are cowardly put out there in the middle of the night so that you can drive over them and you don't know when they're coming or you can't expect it. So it left a lot of veterans on edge, anxious. And then when those events happened, it shook a lot of veterans. So, and you combine that with TBIs, the traumatic brain injuries, and a lot of concussive events that happened. And you've got some very serious PTSD brain injuries. So those injuries are still out there. And if they're not treated, not taken care of well, it can lead to serious problems. So we encourage everyone who's out there who needs help. The VA is a great resource. We partner with them all the time. If you can't get into the VA, there are lots of other great options out there. Don't feel like you're by yourself.
Yeah, I mean, that's a great clarification first, Darrell, and I appreciate you saying that this focus on helping veterans is so important, but it's not like the situation where veterans are coming back and they're not able to do things or they're all broken. There's, to your point, people like you who are doing extremely well, and you're using your experiences to help other people. But we want to be helpful to those who need the help. And you brought this idea of just kind of the modernization of warfare, the IEDs, things that we didn't necessarily see in past wars, that not just lead to trauma of things that we see, but to brain injuries, which could further affect mental health and the road to recovery, so to speak. So I appreciate you bringing that up and kind of setting that up for us. I want to ask you, you mentioned the VA, you mentioned some of the struggles with the VA. talk to us a little bit. For those of us who aren't veterans, you and I both worked in the congressional staffs, and so we understand some of the challenges with the VA. But for those who don't, they haven't worked in the government, or they haven't ever had to deal with the VA as a veteran, where does that add to some of these issues?
Well, Sam, as you and I both know, veterans policy is complicated. Any government policy right now, the government's huge, policy is complicated, and it takes professionals to look at it. Mm-hmm. Right now, there are not a lot of veterans serving in Congress who fully understand the VA system and how it operates, or fully understand the health impacts of that side and how you go forward to do that. So to help get these veterans help, I mean, it's going to take a lot of reform, and Congress really needs to really jump in and get after it. I'm sorry, can you ask that second question again?
Well, what are some of the challenges that veterans face when they go to the VA? You mentioned earlier some of them feel the VA has failed them.
Yeah.
Certainly, I've heard that the VA is better in some parts of the country than others. But what are some of those challenges where you would say that the VA has failed the veteran and has added to some of the stress that they're dealing with?
Absolutely, Sam. I think one of the issues is that a lot of the wounds, injuries right now veterans are facing are very complex. You had a very small number of folks over the past couple of years who deployed regularly. So it's not like past wars where you had mass mobilizations and everyone went over. In this, like, you had an all-volunteer force. And so those same individuals are going back again and again and again. And so the cases that the VA is seeing is much more complex. The problem with the VA is it's a very transactional system by its nature. If you want to go in and see mental health, you can go get mental health. If you need to go get your knee looked at, you can go get your knee looked at. No one's looking at the holistic picture of who you are as a veteran. And that's part of where the problem lies, that you're not looking at a holistic nature. Every veteran, you can't look at it as an individual transaction. And at America's War Partnership, that's one of our biggest focuses, is looking at every single veteran holistically and making a one-size-fits-one approach to helping that veteran.
Darrell, that's a great insight, and a debate that even happens in medicine away from the VA, the idea of a holistic picture in order to help the person and not just treat a symptom or an injury. We're going to go to the break. When we come back, I want to talk a little bit about the organization that you're from, the work that you do. You guys have a lot of solutions to this. You hinted at some of them in the first segment, so don't go away. We'll be right back.
Face the Issues is produced and recorded in the studios of Lighthouse TV. Positively different. Watch Lighthouse TV wherever you go. Available on Roku, Amazon Fire TV, and Apple TV. You can view our in-house studio productions on demand, or watch what's on the station right now with our 24/7 live stream. Search Lighthouse TV online on your streaming device, or go to our website lighthousetv.org for more information. Lighthouse TV, positively different.
Welcome back to Face the Issues. Darrell, thank you again for joining us. Let's pick up right where we left off. We left off talking about some of the challenges that veterans face. I want to ask you first a little bit about what you guys call Operation Deep Dive at America's Warrior Partnership, just some of the statistics that you guys have seen and produced relating to these to veteran suicide and some of the other challenges. Could you go into some of the details about why we see what we see?
Yeah, the numbers are really kind of very interesting, and we're waiting to release the next tranche of data here from Duke University, probably early next year. But the numbers so far, just kind of teasing it out, have been terrific. Just for studying to be able to figure out what the issue is and how detailed, how in depth this issue is of veteran suicide. And some of the big startling statistics were that, one, when veterans die, there's not a really good system for how coroners report who's a veteran and who's not. So a lot of veterans were not being reported as veterans, and a lot of people who did not serve were being counted as veterans. So it was a very confusing back and forth. And actually, one of the biggest issues was a lot of female veterans weren't being recognized. So that was a big issue. On top of that, a lot of coroners and state medical examiners weren't listing these deaths as suicide. They were very clearly, by all definitions to the CDC, a suicide, but there's still that stigma attached to the suicide. So there's a loathing on behalf of the coroner to ever label that because of the impact on the family and the community, et cetera. And finally, one of the other big issues was opioids. The VA does not count most deaths by opioids as a suicide. We call it a premature death. The vast majority of these are fentanyl related. But if you start including the opioid deaths, the number of veterans taking their own lives or dying by opioids and suicide together are catastrophic. It's through the roof. Those numbers, I'm afraid to even say the number on air, how high it is, but it's symptomatic of a larger issue across the whole nation, both in Pennsylvania, both in Ohio, Michigan, the whole Central America, and basically the entire country is having this massive epidemic of fentanyl. I don't think it's any surprise to anybody that veterans are also affected.
Right. And if you're not including those numbers when we're talking about veteran suicide, to your point, Darrell, those numbers are going to be a lot higher than what we're seeing.
Absolutely. I think the number we were looking at when you broke down all the numbers, it was around 44 a day. It's hard to fully quantify that entirely because it's only a small segment of states, but it's statistically large enough to be able to make a broader sample of that. But we want more states to come in. Hopefully Pennsylvania will give us the death data here shortly, and we can bring them to the study as well.
Yeah, absolutely. Let me ask you about solutions. America's Warriors Partnership, this is the stuff that you guys work on, and you have what you guys call an action plan. It's connect, educate, advocate, and collaborate. And you emphasize that this is not just with veterans, but their families, caregivers, and the entire community. Can you walk us through that action plan and why? You guys have something called the AWP network. You have something called community integration. Why is community integration so central to what you're doing?
Great question, Sam. I'm a big fan of community integration. It's a model for how we find veterans and help them. To simplify some of this is that we have communities. We're AWPs in communities. We're not a big national organization. We're a community-focused organization. And what we do is we go in and we find the veterans. We tie them back to the resources. And the resources that aren't there to help them, we bring in on the national level through the network. For example, if a veteran is coming into Indianapolis and needs some help finding a drug rehab facility and goes into a drug rehab facility, the person there finds out they're a veteran, puts them in our software, brings them into the network, and then we can bring resources directly to them, whether that's education resources, more drug rehab issues, employment, VA benefits that they're working on, and bring it all to them so that it's a one-stop shop for them. So it's an efficient use of resources. And then for the network is one of the most important parts of AWP because it ties everything together. And it's the central call center. It's a fusion center. It's a network of networks. And so if we have a problem that we're working on or one of our partners can't work on, they come to us and we match them with other resources from other organizations. There's so many other VSOs out there, the Legion, the VFW, Elizabeth Dole Foundation, Gary Sneese Foundation, IVMF up in Syracuse. They're all great organizations and we partner with them all. And so we're that connective tissue that puts them all together to find the most efficient way to get that resource to the veteran. But the biggest part of that is connecting at the beginning, doing outreach, finding where the veterans are, finding what they need, bringing them in, educating them, letting them know what benefits are available, what resources are there in that community, what resources are there on a national level, then advocate. So we take with their story, and if there's a problem with it, and we're saying, hey, we're seeing a lot of fentanyl issues in these areas, we can bring that back up to the state, local, and federal lawmakers and say, hey, we're seeing some big issues. We're having problems with community care access, boom. And then coordinate. It's about putting it all together.
Yeah, there's two things that you said there that I think just really, really pop out. The first, you work with so many other veteran organizations. A lot of times you see people trying to reinvent the wheel, and this network that you guys have built allows you to partner with other organizations. I know different organizations have different pieces of the puzzle, so to speak, and it gives you that opportunity to kind of pull them all together. The other thing that you said, you mentioned this in the first segment too, was you're not waiting for the veteran to come to you. We know there's a veteran suicide hotline. We know that there's help that they can call. You guys are actively going out and looking for the veteran. What difference have you seen that make in this entire process?
Sam, outreach is key. Outreach is the biggest part. One of the biggest issues right now facing veterans is that there's a lack of trust in the VA system. A lot of veterans either gotten spurned or had their appointments canceled and they leave the system altogether and they're out. They say, I'm not going back. They had my back once, they lost my trust, and I'm out. And so they're off the system. There's 17 million veterans roughly in the United States right now. And of those, only 9 million are enrolled in the VA. And only about a third are actually getting any kind of help from the VHA system or VBA. So the numbers are, you're at 3 to 4 million out of the 17 million. There's a huge delta. There's a huge gap. And they're all out there. It's not that they're totally fine doing their own thing. Even those who are successful and great still want to be part of a community, a veteran community, and we help them find volunteer activities, ways to give back or serve in their community. There's a way to just bring them into the fold again. So outreach is huge on that right now.
Yeah, The other thing I want to ask you, Darrell, I mean, you guys go, you look for the veteran. You don't just wait for there to be a crisis. You're trying to go and prevent it and engage them at an earlier stage. The other thing that you guys talk about a lot is the idea of a community coming together, the idea that this is going to take more than the veteran. I want to ask you, I mean, you have something called Warrior Serve. You have training programs that aren't just designed for veterans, they're designed for people in the community. Talk to me a little bit about the program, but also why the community, and what are things that people like me who've never served but who are in the community, what are things that people like me can do to support the veterans in my community?
So we'll start with the communities we're in right now. We offer a Warrior Serve software. It's basically a casework software. So if you are at any of the resources in that community that touch veterans every day, where you're working with them on, like I said, drug rehab or education or anything else, or healthcare, we'll give you the software and we'll train you up on it so that when they come into the system and you're working with them, you can punch them right in and coordinate with everybody else in the community. Because to be very honest, 80% of all issues for veterans can be solved at the local level. Wow. Which is terrific, because the resources are there. Our communities in our nation love helping our veterans, which is terrific. I can't say that about any other real big group. But that's extremely patriotic, and I love the fact that these communities want to do that. And so it's about tying those resources together to make them more efficient. If someone in the community needs someone to do welding, and we've got a couple of veterans who are nearby who just went to the job placement program who are looking for a welding job, that's boom, it's a natural fit. Yeah. Or even underemployment, trying to find better jobs out there. Oh, hey, I just lost my car. I can't make it back to work anymore. Working with resources either in the local or national level to figure out ways to get that veteran to work, so they can keep their job, et cetera. They can be solved at the local level. That's the secret sauce. And what can't be done, we bring in all the organizations together. Just like you said, it's not about reinventing the wheel. These groups are specializing in what they do. They're subject matter experts. We're not trying to duplicate that effort. We want to use them efficiently. And our job is to be the connective tissue that brings it all together in the network.
So Darrell, there's a group here that's watching this. I mean, you talked about this program, Warrior Serve, that's available to organizations. If there's a group that's watching this, they're not a veterans group, maybe it's a social work group, maybe it's a counseling group, an education group. You're saying that they could be a part of this too, and the fact that they should be a part of this solution. How do they get a hold of this technology? How do they get invested in this? If let's say they're not a veterans group, how do you advise them to go about getting invested and involved in this?
Sure, great question. And to be clear, right now we give Warrior Serve to communities. So if it's going to be a community, we'll go in and we'll invest in the community. We'll give the Warrior Serve to everyone, tie it together. So it's not kind of an individual one or two. But if there are organizations out there who have issues or are looking to partner with us, we'll partner with everybody. We want to make sure that everyone has the resources they need. We are big partners with the National Association of County Veteran Service Officers. So every county in the United States is tied back to the network. So if you're in rural Lackawanna County and you want to and you have an issue, you go to the local county VSO there in Lackawanna and you can call up, and if you have an issue, they'll bring you back to America's Warrior Partnership. It's a great partnership, and that's how we work together. So they're out there, and if you're a veteran and you're in crisis or in need anything as well, you're welcome to call us directly as well. You don't have to go directly to your local level as well. Feel free to reach out anytime.
Yeah. Well, Darrell, I appreciate your insights and just your helping us understand the challenges and the solutions that are available. We're going to go to the break, so don't go away. We'll be right back.
Watch Lighthouse TV wherever you go. Available on Roku, Amazon Fire TV, and Apple TV. You can view our in-house studio productions on demand, or watch what's on the station right now with our 24/7 live stream. Search Lighthouse TV online on your streaming device, or go to our website, lighthousetv.org, for more information. Lighthouse TV, positively different.
Welcome back to Face the Issues. Darrell, thank you again for joining us. When we close out our shows, we always like to get to know our guests a little bit, to humanize them, if you will, beyond the talking point. Darrell, you've served, you still serve, you're in the Army Reserves. You've had a long career in public service, working for the U.S. government, for the Congress. Why choose to go to America's Warrior Partnership? What drove that decision for you? What's your why when you get up every morning there?
Sam, thank you again. And I've dedicated my life to public service. I think it's about being selfless to our nation. You have to put your nation above yourself every day. And so I worked for Congressman Glenn Thompson from Pennsylvania for a long time. He's now the Ag Chairman in the House. And for a long time for Senator Pat Toomey as his National Security Advisor. I've been blessed and honored to have great mentors through this, and I joined the Army at a young age to also serve as well. So when I deployed overseas, I went to Europe the first time after the Ukraine invasion, the first one. I was in Poland for a while, and then came back, and then got called back up, and was over in Germany for nearly 2 years after that. So it was a while, and the second time I had to leave Senator Toomey's office for a long time, and it was hard. So when I was coming back, it was right in the middle of COVID, and the senator had just announced he was retiring, and that transition back and forth is always hard, especially when you're in a small office. And so, I chose not to go back to the Senate to help with the transition. But that means I was coming back from deployment with no job. I just gotten divorced, so my family wasn't there, and I was forced to quarantine in a hotel that the Army made me pay for out of my pocket. So I was there for 14 days sitting by myself with no family or friends because it's still COVID. So everyone's in quarantine and not talking to anybody. So there I was, no job, no family, no friends, no house. My house was gone now at that point. And so I get what veterans go through when they're talking about hopelessness. That was a tough moment for me. And in that moment, I think I know someone upstairs is looking out for me. And I'm very grateful. I got a call from a guy named Jim Lorraine, who's the president and CEO of America's Warrior Partnership, who heard from a friend that I wasn't going back to the Senate, and he called and said, "Hey, you got to come work for me. Here's what we do." And I said, "This is perfect." I love helping people. I love helping veterans. Those who dedicate their lives to the nation, like I have a soft place in my heart for them. I will always work my tail off every day for them. And so it's an honor to work for AWP in this organization. I think we do great work. I think we're one of the biggest organizations no one's heard of yet, which is good because we're happy to just do the work on the ground and be there and help people. That's our job. And so if you know anyone who needs help, reach out anytime. If you need help from me or anything else, let me know. I love work on the policy issues. It's what I've known. It's what I've done. And so I love it. Yeah.
Darrell, thank you for sharing that. Of course, like I said earlier, we thank you for your service, both in the military, but also as you help all those others who served. Darrell, what is the website for those who want to reach out or potentially want to reach out to support your organization? What's the website?
Thank you. Our website is americaswarriorpartnership.org. You can go online, check out all our programs, resources, and if we can help out with anything, please let us know. And if you're a veteran in crisis or just want to talk to a fellow veteran, we have a great partnership with Vets for Warriors. Feel free to give them a call anytime. You can talk directly to a veteran and work with them, and it's all free, so don't hesitate to reach out.
Great closing words. If you are in crisis, don't hesitate to reach out. Darrell, thank you for your service. Thank you for joining us.
Thank you, sir.
That is our show for tonight. I want to thank Darrell Owens from America's Warrior Partnership for joining us. And of course, I want to thank each of you for tuning in as well. We hope to see you right back here next week. Until then, my name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.